Hi, everybody, and welcome to this EHMA webinar. Great to have you all with us today. Today's theme is unpacking the fragmentation that makes older people at higher risk of infection. I'm George Valiotis, and I am the Executive Director of EHMA, and I'll be moderating today. And in today's session, what we have for you is a quick introduction from me, and then we'll go into the presentation. If I can have the next slide, please. Right, we'll do the practical information first. So I think some of you might have joined our webinars before, so you'll know that your microphones are muted to make sure the audio is kept clear. If you have any questions, you can submit it in the Q&A box below. So at the bottom of your screen, there are a few little options there, but you can also raise your hand. And the way you raise your hand is you go into your participant list, and there's a few options down the bottom. And if you raise your hands, what we can do is go to you live, and you can live on your video and microphone ask your question. You can type a question at any time, but we'll take all the questions at the end of the presentation. We do record these webinars as well, so you can check them out on our YouTube account, or just go to our website that's listed there. And also we'll be tweeting about this session, so feel free to contribute, but with the hashtag EHMA webinar. So that's the practical information. Now to walk you through what we're going to do in this session today, we're joined by Dr. Andrea Rotolo. So thanks for joining us today, Dr. Rotolo. And he's going to talk about fragmentation in health systems, obstacles in managing nursing homes during the pandemic in Italy, and international comparisons, looking at differences between Italy and other countries. We'll have a 15-minute presentation by Dr. Rotolo, and then we'll go to questions and answers. So I'll welcome you, Dr. Rotolo. Thanks so much for joining us today.
Thank you for inviting me. Good morning, everyone.
Dr. Rotolo, you're a lecturer at SDA Bocconi School of Management and Sergas, and researcher at Bocconi University. Thanks for joining. I will hand over to you, and I look forward to your presentation.
Thank you very much, and thank you again for having me. I'm working at the SDA Bocconi School of Management, and there we have an observatory, which is called Observatory on Long-Term Care, where I work with other colleagues who are Elisabetta Notarnicola, Sara Berlotta, Eleonora Perobelli, Francesco Longo, and Giovanni Fosti. And today I will present you some of the results of the research we did together, and especially I will focus on the topic of fragmentation and its impacts on older people's health, especially during the COVID-19 pandemic. And before starting, I would like to define what I mean by fragmentation, and from my perspective, and I use this definition you can see in the slide. Fragmentation basically means focusing on single pieces, on single parts of a system, without looking at the linkages and the consequences they have on other parts. So without looking at the system as a whole. And this, of course, applies to healthcare systems, and especially when we talk about older people. And as you can imagine, you can use different perspectives to look at the topic of fragmentation. And today I will especially focus on fragmentation at the policy level, fragmentation of data, and also fragmentation at the service level. And again, as I said, the focus is older people, so I will talk mainly about long-term care sector. I will start from Italy, and then I will go to some international comparisons, let's say, especially during the management of the COVID-19 pandemic. And maybe the key message I wanted to give you today is that what we observed during the COVID-19 pandemic and the effects on the older part of the population in terms especially of outcomes, of health outcomes, which means in many cases, unfortunately, many deaths, is the impact of a pre-existing fragmentation. I will start by the case of Italy. This fragmentation in Italy existed, and here you can find four examples. The first one is about the policy level, and national, but also regional policies are traditionally more focused on the healthcare sector and less on the long-term care sector, and the integration of the long-term care sector with the healthcare sector services and the social care services and everything that's in between. And also another problem we observed is that the strategic orientation and the mission of services of the healthcare sector were pretty clear, while we never really defined what should be the mission, the strategic orientation of the long-term care sector and its services. And then also we have a really poor quality of data that helps us describe the LTC sector in Italy, which means in terms of availability, of homogeneity, of updates of data. And of course, since I'm a researcher, this is a big issue, but this is of course an issue if you think about the strategic planning of the sector of the services. Sorry. And we also have, as many of you answered in the poll, weak linkages, so fragmentation at the local level between services targeting older people. And back in 2019, so before the COVID-19 pandemic, we, in a report that we do every year, we highlighted some of the critical areas we can observe at the service level. And here you can find the 5 areas. I will not go into details of each of them, but for example, you have the problem in Italy, and you had the problem of overcrowded emergency rooms in hospitals, because there were many older people going to the hospital, even if it was not the appropriate answer to their health need. But also you had the problem that when older people were discharged from the hospital, it was not followed by services, for example, like home care services or other types of services. So you could see this fragmentation, and it worked also the other way around. So for example, when a patient from a rehabilitation center needed to go to the hospital and back, and again, I think you can see then the impacts today when we look at what happened during the pandemic. So in February, late February, COVID-19 strike in Italy and other countries, and you can see all the effects of this fragmentation, because, for example, the Italian government was very late in acting in response to the COVID-19 outbreak in nursing homes. It took many weeks before something practical was done to address that problem. Also, if we look at the regional level, because in Italy, the long-term care sector the regions are responsible for issuing operational regulations for the long-term sector, and they acted again late and with very different policy measures from one region to another. And just to give you an example, some regions issued the first operational guidelines about the isolating patients and testing screenings almost 1 or 2 months after the first cases were discovered in Italy. So we're talking about a long time. Again, as in many other countries, Italy faced also a shortage of personal protective equipments, and nursing homes were not prioritized for the distribution from the central level, while the healthcare sector and hospitals specifically were prioritized. So this meant that nursing home had to acquire the PPEs by themselves, but it was really hard, especially in the first months. Then we have problems with the data. So we have a survey that tells us that the number of deaths were much higher than the ones officially registered at the central level. And I will go back to that in a few seconds. And another key point that is a consequence of what I've told you before is that it was a poor coordination with the other healthcare actors from nursing homes. The example here is that in many regions, hospitals stopped admitting patients in critical conditions from nursing homes into the hospitals. So they were left to the cares of the nursing home, but as you know, they're not equipped to deal with complicated clinical situations. So the result is that nursing homes has been left alone, isolated in dealing with the emergency, especially in the first months of the pandemic. And going to the fragmentation and the importance of data, I will just tell you that the only official and let's say national numbers that we have about what happened in nursing home for older people is a survey that was launched I think it was April, but it stopped in July. So the last update was in July. And this is just to tell you that today, when we are during the so-called second wave, we don't know what's happening in nursing homes. And as you can see, the results basically tell us that the main obstacles that nursing homes faced was the lack of PPE, first of all, and then the lack of testing for patients and also for workers. Let me just go to a quick comparison between what happened in Italy and also what happened in other countries. First, some numbers. Well, one important number is that 46% is the estimate of the overall number of COVID-19 deaths related to nursing home residents. So this is an important message that probably more attention and resources, of course, should be directed towards nursing homes and the long-term care sector during this type of pandemic. So we should bear this in mind also for future pandemics, but also for future waves, because we are in the middle of the second wave here in Italy, and there probably would be a third during the first months of 2021. And then if we compare the percentage of residents in nursing homes died by COVID-19, we can see that there are differences, sometimes relevant from one country to another. Here you can see the case of South Korea, where really few people were dead in nursing home with COVID-19. And then we have Germany here in Europe that managed better than other countries this situation. France has 2.4% of deaths in nursing homes, while we have higher numbers in UK, USA, and Belgium. And then Italy, big question mark, because we don't have real statistics and updated statistics on that. And this is, of course, a problem, as you can imagine. I will conclude on that, saying that we identified three main problems in the management of a pandemic, of a COVID-19 pandemic for older people, especially in nursing homes in Italy. First, isolation. So it was difficult to isolate positive patients, while we have seen that other countries, such as here you can see the example of Germany, but then also Hong Kong issued specific policies on that, and also had specific facilities or spaces to isolate positive patients also from nursing homes. And this made the difference in terms of outcome, as you can imagine. And then we had this big problem of screenings, so performing tests for both residents and workers of nursing homes. While in other countries, such as here you can see the Netherlands and Austria and Belgium, there was some type of massive screening performed also on workers of the long-term care sector, and this of course helped identify also some characteristics and features typical of this pandemic, such as the role of asymptomatic positive cases. among staff and patients. And last but not least, it's a problem that we see especially today in Italy. It's financing and economical and financial sustainability of providers of long-term care services and nursing homes especially. We didn't act until probably a few weeks ago, while we have seen that, for example, the Netherlands, Austria, and Germany, they issued a public fundings for, first of all, hiring additional personnel, and then for guaranteeing economical sustainability in the medium long term for the sector. So they try to help and sustain the providers in this difficult period. So no, it's very quick, but I try to wrap up in this way. As I told you at the beginning, I am, and with my colleagues, we are convinced that fragmentation of long-term care sector services, policies, and linkages with other parts of the whole system, so healthcare system, social care system, is a problem, and it was a problem before COVID-19. The peculiar element here that I wanted to underline is that, of course, each country, Italy, but also other European countries, were not prepared for this pandemic. There was a lot of uncertainty, but I did a really quick Google search of the news in February of this year. We only knew one thing for almost certain, that and this was that the virus, the COVID-19, was particularly affecting with also negative health outcomes, especially older people. Well, the fragmentation that we had before just didn't let us tackle this issue, and unfortunately, we have seen tragic consequences. So I hope it was some messages also for some discussion and reflections from your side, and also if you have different perspectives and different examples from your countries, well, I'm really curious to hear.
Thank you very much. That was a great presentation, and we do have time for questions now. I can see already in the chat box there's a question from John Orevit. Thanks for joining us again, John. John, I was wondering if you're happy to come on camera and actually ask your question live. We could make that happen since we've got a bit of time. Yeah, great, fantastic. Hi, John.
Hello, George, and thank you very much, Andrea. I'll be brief. Here in Stockholm, we're working hard on the logistics and arrangements for the vaccination. And one of the issues in Sweden, we have a separation between municipalities that provide long-term care in care homes, and the doctors that serve those homes are contracted separately by the county. The nurses that work in those care homes are employed and organized separately. So the doctors have to order the vaccine from our receiving site. The nurses then have to receive them and administer them. And meanwhile, in terms of other home care services, we have specialist medical at-home home care services, which we provide by the county, that visits people in their homes who need specialized medical care at home if they're able to. So the priority is over 70 people at home. That is what the Public Health Agency has said, which covers both of these. But you can see the possibility for issues about registering the patients, ordering, ensuring the vaccination, training the vaccine. Is not quite clear who's responsible for training on some of the specifics on the Pfizer 80-degree issue and when they're delivered there. So it really is quite a complex thing, and it would be I was curious what the situation is in Italy as regards that, and whether it would be tragic yet again for the fragmentation to undermine things at the last post, just as we're about to get there. And then there's a whole issue about the staff themselves in those care homes being vaccinated and who's responsible for that and how they get that. Any thoughts about that, or any extrapolations from your understanding of fragmentation as regards what to look for and some of the issues in terms of the vaccination? Because there's a whole set of issues about data fragmentation, because there are 2 doses, and how the information is registered, and then collecting any data about side effects and so on. I'll stop there. Thank you, George.
Thank you. Well, I mean, I would say that in John's country, which is Sweden, right? Yes, they are much ahead of us, because they are already tackling the issues, and at least they are asking themselves where could be the problems of integration to get everyone the vaccine, especially older people. While here in Italy, we are, I think, we stopped or we didn't proceed from the question who should get it first. So we don't have details on how operationally it will be implemented. So who will acquire it, how you will bring it to the nursing home, so who will basically do the vaccine and so on. So I'm very worried about that, and also because I have seen and we have seen that, again, fragmentation impacted this year on the other vaccine, which is the influenza vaccine. That you have seen this fragmentation from the central level and the guidelines at the central level, and then the regional level, where some regions didn't acquire enough doses of the vaccine, and then GPs who didn't, all of them applied for being part of the vaccinal campaign. So some patients had to call a separate number, some other patients had to call their GPs, and their GPs was doing the all the process. So I'm very scared, but I hope that soon we will know more about the plan, because at the moment I am not aware of a plan. So looking at the fragmentation we discussed, and also looking at the difficulties that you were telling us, I hope that someone here in Italy soon will tackle this issue.
Thanks, Andrea. And we do have time for a couple more questions. So if anybody did want to put their hand up and ask that live, then you're welcome to do that. Dr. Rotolo, my question to you is that you've outlined a lot of challenges. And of course, I think a lot of people just want easy-made solutions handed to them. Are there any features that you see things that help systems evolve from being separated and fragmented to addressing that? Because you said it's been a long-term issue. So what are things that people could do to start to overcome it?
I mean, my personal opinion is that if we had to invest on one thing, is on data, on statistics, telling us how people are doing, and the characteristics of the population, and what are the healthcare needs, long-term care needs, who are the users today, how long are they staying in nursing homes. And we don't have a national picture, but sometimes even a regional picture is hard to describe. So because I'm convinced that, I'm sure that if you have data and statistics, then you can do some planning, and policies can be consistent. Otherwise, I don't know on what basis you are planning. You know, it's just on the basis of what the policymaker think, because if you don't have data on your table.
All right, so that's a great point. So data helps drive accurate decision making. But then what about leadership? Like once you have that data, what are the other features that you see help address fragmentation effectively?
Well, I mean, leadership, it's an important point, and I didn't have time to cover it today, but I described an overall picture, but we also have seen some examples and some cases where, there are people, managers of nursing homes or other types of services targeted to older people, who themselves were the main actors of the integration. So they acted on first hand and tried to overcome the fragmentation of the system. So they tried to build a long and structured relationship with hospital services, with the GPs of their territory, and so on. But again, it's limited to some cases. So I think then you need also that there are competencies and managerial skills that will implement that idea of integration and a new approach to the long-term care services and taking care of older people's health.
Okay, so there's various things that can happen in leadership once that data is there. For systems that are existing without those features to their level of satisfaction, what do you see happening? Like, do people just keep pushing through without this data? Like, what's your hope for Italy, for example, that you don't have this data now? Is in the absence of that data, what will systems keep doing? Or is that just I know that sounds like a ridiculous question, but I'm thinking if that change isn't happening, then
the problem, I'm not sure it's a problem, but what we see in Italy is that public services, but also private services, they are not able to answer to all the needs that exist. They don't have this issue because they're the nursing homes were not empty before this pandemic, and services are overcome by demand, and it's a problem of perspective in my opinion. The public services now look only at those people who are able to receive the service, but they know basically nothing about what's happening outside. So many families are obliged. I mean, they need to find an alternative solution. Sometimes they do it within their family. Sometimes they use informal caregiving, and that's the reason why, for example, in Italy, we estimate we have more than 1 million informal caregivers, while the national health systems employs 600,000 people. So if you see, there's this parallel system of caregiving that has happened in the meantime. So to answer your question, if nothing changes in the meantime, families will keep organizing by themselves, and the public service will keep giving answers to those people who are intercepted in some ways.
Okay, well, thank you for those insights, Dr. Rodolo. And if that brings us to the end of our time, but if people did want to get in touch with you, we've got all of the information on our website. So, and you'll get an email that summarizes this session with the link to the page on our site, as well as to the recording. So if you did want any more information, you can do that. And I thank you very much, Dr. Andrea Rodolo, for your great presentation and your connection to EHMA.
Thank you very much, and thanks everyone who has listened.
This is the last webinar that we'll be running for the year. So I wish you all a Merry Christmas if you celebrate that, or Happy Holidays. And we look forward to joining us in the new year. If you have any topics or ideas for webinars, then do let us know. Many thanks, take care, and goodbye.